What are the issues faced by people with mental illnesses? People with mental illnesses are commonly and repeatedly made to endure public and social stigma. The symptoms arising from mental illnesses are not the only problematic area though. Another includes the disadvantages faced through society's reactions. Data has shown an increase of citizens not employing people with mental illnesses, renting apartments to them, and in some more serious reports, more likely to falsely press charges against them for violent crimes. Studies have revealed that attitudes and beliefs that are of a stigmatizing nature towards individuals or groups in regards to mental illnesses will and does have a negative impact on the lives of those with mental illnesses as well as their road to recovery. Further studies have illustrated some of the main stigmatizing attitudes people in communities have towards those with mental conditions. These include people blaming parents for the causing factors of mental illnesses, residents strongly opposing any mental services or facilities being constructed near them, and the negative views employers have on hiring people with mental disorder. An interesting story posted on Facebook a few months ago outlines the effect stigma has on people with mental illnesses and the harmful factors that can sometimes unintentionally emanate from family. There was a male student, Matthew, that was 24 years old. He had stayed in hospital many times due to acute symptoms he was facing with schizophrenia. The last time he came out of hospital, he was symptom-free for about 3 years. He was living on his own in an apartment, had a secure job, and had many friends close by. Although not long ago his schizophrenia symptoms came back and was again hospitalized for a lengthy time. It took him 3 months to recover and get ready for work again. Unfortunately though, his boss discharged him as he thought Matthew might have an outburst while at work due to his mental illness. Furthermore, Matthew's family were extremely worried that it was becoming too risky for him to live by himself, so they made him move in with them. Since the family's home was in a different state, Matthew lost contact with his friends too. Although he recovered again, Matthew had no friends, no job, and no apartment, leading to a continuous cycle of negative factors influencing his mental health. What dimensions of stigma are related to mental conditions? The 6 dimensions of stigma have a direct correlation with mental illnesses. For example, the first dimension, concealable. This is shown many times when people witness an act of stigmatization towards an individual and encourage it by laughing or even staying mute. Another main dimension frequently shown towards people with mental illnesses includes the 6th dimension, peril. This describes the fear or danger people with mental conditions face when seeking medical advice or treatment, as they perceive they will get harshly criticized for it. What are some ways we can help reduce stigmatization around mental health? There are many ways stigma can be improved and eventually overcome. The first is through education. Anti-stigmatization initiatives towards mental illnesses in a local and national level are a good starting point. It can include school-based projects and workshops, which actively involves the students and raises their awareness of stigmatizing against people with mental illnesses. Furthermore, another vital group needing educating on the effects of stigmatization is those in the media business. It should include educating journalists, news reporters, and other TV personalities so that they don't promote stigmatizing messages on TV. Protests are the next line of defense. Many protests have changed attitudes within countries and have paved the way for anti-stigmatization laws and legislations. So what influences people on participating in interventions and programs? The symptoms of mental conditions can greatly be improved with treatment. Thus, it is imperative there is no negative views held towards those receiving treatment for their mental illness. Unfortunately, those who are likely to benefit from participating in interventions either choose not to participate or end their intervention program early due to stigmatizing factors. It has been estimated that less than 2/3 of people with schizophrenia actually undertake treatment. Moreover, almost half the people on antipsychotic medication don't comply with their prescribed medication. There are reasons to the limited participation to treatments faced by people with mental conditions. For example, some believe that the side effects caused by certain medications outweigh the benefits. While on the other hand, the most commonly used reason for not receiving treatment is the fear that after getting treatment, they will be labelled as someone with a mental disease. Studies have shown that people with mental illnesses were less likely to use available services or resources if they expected their community, family, or friends to have negative reactions towards them. In conclusion, it is vitally important to understand the negative effects associated with stigmatizing against those with mental illnesses and how it can influence individuals with receiving treatment and participating in interventions.